Cancer. A cancer diagnosis is scary news, and there are so many emotions, thoughts, and fears that come along with it. One thing a member shouldn't need to worry about is whether they can afford treatment and if their medical bills will be eligible for sharing. Here is how cancer sharing works. First, let's review limitations. If a member was diagnosed with cancer within 5 years prior to their active date, any cancer expenses would not be eligible for sharing. However, if a member was diagnosed with cancer more than 5 years prior to their active date, a newly diagnosed cancer, that is unrelated to any prior cancer, would be considered eligible for sharing. Now let's discuss newly diagnosed cancer, which is eligible for sharing after a 90-day waiting period. If a member is diagnosed with cancer during the 90-day waiting period, the cancer would not be eligible for sharing. OneShare Health provides cancer sharing after the member meets their individual sharing amount up to $500,000 per member, but keep in mind each incident cannot exceed the per-incident sharing maximum. So, what is the process to determine eligibility? Cancer care and treatment is required to go through pre-notification. At that time, a medical review will be completed by our clinical operations and support teams. Once a determination is made, the member and provider will be notified on whether care and treatment is eligible for sharing. OneShare Health wants to be there for our members when experiencing an unforeseen health crisis. Our community supports one another, prays for healing, and shares in one another's medical needs. We are truly better together. OneShareHealth.com. Please remember to review your member guidebook for a list of eligible services.